Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The motor-free visual perception test assesses an individual's visual perceptual skills without requiring motor involvement. Its primary purpose is to evaluate visual perception abilities such as visual discrimination, spatial relationships, visual memory, figure-ground differentiation, and visual closure. The test is commonly used in the diagnosis and assessment of neurological conditions, developmental disorders, and visual processing deficits. It aids clinicians in identifying specific visual perceptual impairments that may affect daily functioning, learning, and rehabilitation outcomes. The assessment is standardized and designed for individuals across a broad age range. The motor-free visual perception test is indicated for patients across the lifespan who require assessment of visual perceptual skills without the confounding influence of motor abilities. It is particularly relevant for individuals with neurological impairments such as stroke, traumatic brain injury, and cerebral palsy, as well as those with developmental disorders, including autism spectrum disorder and learning disabilities. The test is most useful in clinical contexts where motor limitations or deficits are present, which may impede accurate evaluation of visual perception using standard methods. It aids clinicians in differentiating perceptual deficits from motor dysfunction, guiding targeted rehabilitation and educational interventions. The motor-free visual perception test consists of 45 items designed to assess visual perceptual abilities without requiring a motor response. The test includes questions on visual discrimination, visual memory, spatial relationships, form constancy, visual sequential memory, figure ground, and visual closure. The examiner presents each item in a standardized format, typically involving the identification or matching of visual stimuli. Responses are provided verbally or by pointing, eliminating the need for writing or fine motor skills. Administration begins with the examiner showing the test stimulus and then presenting multiple choice options, from which the examinee selects the correct answer. Scoring involves tallying the number of correct responses to derive raw scores. These raw scores are then converted into standardized scores based on normative data that account for age. Standard scores have a mean of 100 and a standard deviation of 15, with scores between 85 and 115 considered within the average range. Scores below 85 indicate below average visual perceptual skills, suggesting potential deficits requiring further evaluation. Percentile ranks and confidence intervals provide additional context for interpreting the results in relation to the normative population. The motor-free visual perception test demonstrates variable sensitivity and specificity depending on the clinical population and cutoff scores applied. Sensitivity refers to the test's ability to correctly identify individuals with visual perceptual deficits, while specificity denotes its capacity to accurately recognize those without such impairments. Studies have reported sensitivities ranging from 75% to 85%, indicating that the test correctly detects visual perception dysfunction in approximately 3/4 to slightly more than 4/5 of affected patients. Specificity values have generally been found between 80% and 90%, reflecting a high rate of correct identification of individuals without deficits. For example, in a clinical setting, a sensitivity of 80% means that out of 100 patients with a visual perceptual disorder, 80 will be correctly identified by the motor-free visual perception test. A specificity of 85% suggests that out of 100 patients without the disorder, 85 will be accurately classified as unimpaired, minimizing false positive results. The motor-free visual perception test was originally developed by Jean R. Dunn in 1981 with the intention of evaluating visual perceptual abilities without the confounding influence of motor skills. Since its inception, multiple studies have examined its psychometric properties, reporting strong evidence for reliability and validity. Dunn and colleagues established normative data based on a large sample of children and adults, providing age-specific percentile ranks and standard scores. Subsequent research has corroborated high test-retest reliability, with coefficients commonly exceeding 0.9. Construct validity was supported through demonstrated correlations with other established visual perception assessments, while maintaining low associations with motor-dependent tasks, thus confirming the test's motor-free emphasis. Additional investigations have extended the normative framework to various clinical populations, including individuals with brain injury and developmental disorders, further affirming the tool's sensitivity and specificity in detecting visual perceptual deficits. Factor analysis studies have delineated distinct components of visual perception assessed by the test, enhancing the theoretical underpinnings of its measurement model. These cumulative findings underpin the motor-free visual perception test's position as a scientifically supported instrument for visual perceptual evaluation in diverse healthcare settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.